most common symptom being heavy vaginal bleeding can be very, very disabling and debilitating for some women, affecting their activity of daily living, such as being able to go to work, being able to care for their families, even being able to do simple things like exercise, because they just bleed through their clothes. In these women, once we have tried using intrauterine devices such as the Mirena, or we have tried other methods of treatment in order to preserve the uterus, and all of these other methods of treating uterine fibroids whilst trying to preserve the uterus, if a woman has completed her family, it is out of the scope of this video. Therefore, it's not surprising that a study has found that when this type of fibroid is removed, the rate of pregnancy is seen to have doubled. And submucosal fibroids are removed through a procedure known as hysteroscopic myomectomy. This procedure is recommended for small fibroids that do not penetrate deep into the uterine wall. Other ways of removing fibroids include abdominal and laparoscopic myomectomies. With the abdominal route, an incision is made, the pelvis is open, and then the fibroid is removed. This technique, though, is predominantly for intramural fibroids, as well as when there are multiple fibroids to be removed. But removal of an intramural fibroid will lead to scarring. And scarring tissue stretches less than the original smooth muscle that was there before the fibroid was removed. As a result, if you remove an intramural fibroid and you get pregnant, there is a risk of rupture to the uterus, simply because you've lost some of the elasticity that would have been found in the original smooth muscles, now replaced by scarring tissue. Laparoscopic mectomies offer benefits such as shorter recovery time, less postoperative pain, and there are reduced risk of complication with laparoscopic myomectomies in comparison to abdominal myomectomies. So, in summary, should you remove uterine fibroids if you are trying for a baby? I would say the first question you need to be asking is, what type of uterine fibroid? If the doctor tells you that it is a submucosal fibroid, particularly when you have several submucosal fibroid, then these will be well worth removing. And the preferable way to remove these is laparoscopically.